So welcome to day 12 of 30 Days to Better Hearing. Yesterday we talked about earwax, and today we're going to talk briefly about ear infections. Firstly, it's crucial to recognise that whilst hearing aids are designed to be safe and enhance your hearing, they can in some cases contribute to the development of ear infections if not managed properly. This typically happens when the device creates a moist environment in the ear canal, which can then become a breeding ground for bacteria or fungi. One of the most effective ways to mitigate this risk is by ensuring the parts of the hearing aids that come into contact with your ear are meticulously cleaned and disinfected regularly. Now, on day 4, we talked about daily maintenance, and it really is as simple as keeping on top of this, using a soft, maybe slightly damp cloth to wipe the parts of the hearing aids that go in your ear daily, and then employing disinfectant wipes or sprays designed for hearing aids. They can make a significant difference. And that's it really. Spotting the signs of an ear infection early is also vital. Symptoms can include itchiness inside your ear, or a feeling of fullness or pressure, pain in the ear that might become severe, or discharge from the ear. If you experience any of these symptoms, it's essential to consult with a healthcare professional promptly. Preventative measures extend beyond cleaning though. Ensuring that your hearing aids fit properly is also crucial. An ill-fitting hearing aid can irritate the skin and create pressure points that can actually create little cuts in the skin, further increasing the risk of infection. Going forwards, it's going to be important to have regular checkups with your audiologist, not just for the maintenance of your hearing aids, but also to ensure that the fit remains perfect for your ears, as they can change shape over time. Additionally, during these checkups, your audiologist can inspect your ears for any signs of irritation or infection that you might not have noticed and get right on to helping you. So it's just another thing to be aware of. Don't panic. Having hearing aids doesn't mean you're suddenly going to get loads of ear infections. You just have to be sensible and make sure you aren't increasing your risk. Stay tuned for day 13. I'll see you tomorrow.